My name is Murky Sloan and I'll be your pharmacist today. Today we're talking about MT. MT is a 27-year-old African American female with a chief complaint of increased asthma symptoms. She has a history of mild persistent asthma, complaining of increased asthma symptoms but does not appear to be in acute distress. States that she has daytime symptoms approximately 3 times per week, uses her rescue inhaler 3 to 4 times per week, but never multiple times on the same day. She is awakened by her symptoms approximately 1 time per week. She states good compliance to her asthma medications and demonstrates proper inhaler techniques. Her past medical history shows mild persistent asthma that was diagnosed within the past year, and she's on maintenance and rescue inhalers. Her insurance is Anthem Blue Cross and Blue Shield. She has no pertinent family history, but her social history indicates that she denies recent alcohol intake and she was a former smoker. She indicated that she quit smoking around 3 years ago. Her medications include Topramate 100 milligram tablet by mouth twice a day, a Trispentec 28-day pack 1 tablet by mouth daily, a fluticasone propionate 88 microgram 1 inhalation by mouth twice a day, an albuterol inhaler 2 puffs by mouth as needed every 4 hours. Her allergies include a gabapentin allergy with the results of edema. Her vaccine history shows that she's up to date on all her vaccines and received her influenza vaccine of January of this year. Her physical findings show increased asthma symptoms, but no acute distress presently. Her lungs also show mild wheezing. Her vitals include a blood pressure of 110/72, a heart rate of 90, a respiratory rate of 18, a height of 69 inches, a weight of 158 pounds, a BMI of 23, and an ideal body weight of 66 kilograms. Her labs came back all within normal ranges, and her creatinine clearance is 120. So the problem for this patient is increased asthma symptoms due to mild, persistent, uncontrolled asthma. Based on the GINA guidelines, the patient is showing 3 of 4 symptoms for the assessment of uncontrolled asthma. This would indicate mild, uncontrolled asthma. This would also indicate a need to increase the patient's asthma therapy. As indicated in box 7 of the guidelines, we have a few options that we could do. We could increase her treatment by adding a low-dose ICS and a LABA, or a medium-dose ICS. In this situation, I would recommend keeping the albuterol and discontinuing the fluticasone and adding a Symbicort inhaler. This would transition the patient from a step 2 of therapy to a step 3. My goal for this patient is to relieve symptoms of asthma, prevent exacerbation, and relieve symptoms of insomnia due to the patient waking up for the need of a rescue inhaler. So for the Symbicort, I would recommend an 80 microgram over 4.5 microgram inhaler, 2 puffs by mouth twice a day, indefinitely. For this patient, you would want to counsel them that there might be a risk of thrush. So in that situation, you would tell the patient to wash their mouth after using their inhaler. They also might experience some abnormal heart rhythms, heartbeats. So you may want to counsel them on that. And then they should expect to see improvement within a week. So what questions do you have for me today?